Hi, I'm Kristy Weber. I am an orthopedic oncologist and vice chair of faculty affairs at University of Pennsylvania Department of Orthopedic Surgery. You are listening to Interview with a Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Kristy Weber, Vice Chair of Faculty Affairs, Chief of Orthopaedic Oncology at Penn Medicine, and Director of the Sarcoma Program in the Abramson Cancer Center. Dr. Weber has built a collaborative sarcoma research team combining clinical and basic research between Penn Medicine and Children's Hospital of Philadelphia. Dr. Weber was a 2019 president of the American Academy of Orthopedic Surgeons and is the Academy's first female president. She also served as a chair of the AAOS Council on Research and Quality for 4 years, where she spearheaded initiatives regarding clinical practice guidelines, evidence-based medicine, appropriate use of criteria, patient safety, biomedical engineering, biological implants, and the development of orthopedic physician scientists.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Kristy Weber, Vice Chair of Academic Affairs at Penn. Doc, how are we doing today?
Doing great, Matt. Thanks.
Thank you so much for being with us. So as you know, the focus of this podcast is really surrounded around chief residents and fellows. So thinking back, what were your goals and aspirations during your residency and how have those changed throughout your fellowship?
Yeah, it's a great, thanks for doing this. It's a great service to those in that aspect of their training. So when I think back, I mean, it's like 30 years, so I have to think way back. But I think that my goals, early in residency were just to sort of get through the day and learn as much as I can and try not to hurt anybody early on. But as you graduate responsibility, as the residents watching this know, you become more knowledgeable, more skilled, and you start putting your focus toward the future. My goal in residency, I did my residency at the University of Iowa Orthopaedics, was to end up with a reputation, a really good reputation. So I want to be remembered for being a really hard worker, a compassionate doctor, have good hands in the operating room, and really be really knowledgeable about orthopedics in general. My goal at that point was to get a fellowship because I had decided that I would go into an academic career, and I wanted to do well in the field in general. I wanted to contribute. I wanted to be a really good doctor and a really good surgeon. So that's what I was thinking about in my residency. I obviously had to choose a subspecialty, and I, like many residents, was wavering between several options. I thought maybe about a hand surgeon or a pediatric orthopedist, but I settled on tumor surgery, orthopedic oncology, and partly because I just had incredible mentors at my program, and so I got into a fellowship. At that time, there was no match program, so people could offer fellowship positions to anybody at any time, multiple years in advance. So that was a challenge. The match system's been better for orthopedics. So I looked at multiple places and ended up at the Mayo Clinic for my training. But one point I want to make is that I was not thinking of doing anything more than a 1-year fellowship and then getting out into the workforce. But I wanted to go to the Mayo Clinic, and they already promised the spot to somebody. So I didn't have the option to go there unless I was going to put in another year in the laboratory. And I had some interest in the lab. I wouldn't say I was a rock star, but I think that idea that life is not a straight line. What you think is what you're going to do. Maybe you're going to make a little zigzag. So I took that opportunity to do a year in the laboratory at Mayo before my clinical fellowship, and it set my career to being really, I've done a fair amount of lab work over my career, and that was real positive for me. So it wasn't what I expected, but better than I thought.
So thinking about that fellowship year, what was your mentality heading into your first job search, and how did that perspective change in the beginning years of your career?
Yeah, well, actually, let me just go back to the fellowship year. So, then you're going from the residency to fellowship, and in fellowship, you're obviously thinking ahead to the job search, and that's pretty stressful. During that whole year, I spent that year really honing my skills to become an orthopedic oncology surgeon. I tried to learn everything I could. I tried to be in every case that I could. I presented at every meeting that I possibly could. I tried to network in the community. This is a fairly subspecialized area of orthopedic surgery. So my mentor at the Mayo Clinic, Frank Sim, was amazing at introducing me to some of the key players in the field. And I think those introductions are critical, right? You get an introduction. That's easy. What you do after that introduction to prove yourself and to do a good job, that's where the work comes in. So I looked I looked for an academic job. I started looking right when I got to my fellowship. So I was really looking 2 years in advance. And one thing that I did is I set up interviews during our national meeting a year in advance because it was free. Free for me because I was going anyway, and all the chairs of departments that I would be looking at were also going, and so it didn't cost them anything to meet with me. Super easy. I think it was really strategic. So I had probably had 12 meetings, and most of those people probably weren't even looking for somebody, but I got to meet people. I put myself on their radar, and so I think that was a strategic move. So as far as my first job process and looking into getting a job, that's not easy. And again, I think probably many of the people watching these interviews looking for private practice jobs, but there's certainly a population that's looking for an academic job. And in tumor surgery, what I do, there aren't that many jobs. You have to wait till somebody either retires or they die. So it's really dependent on timing. So similar to looking for a residency, looking for a fellowship, you're looking around at your options, you're putting in your own personal needs or wants related to if you have a family or location in the country, pros and cons to different opportunities. I ended up having 3 choices that I looked at seriously, and I had a couple interviews at each. All of them were different. It went from maximizing my personal life at a location in the country where I would have loved to live, to maximizing my academic career at a major cancer center. And I had to wrestle with that. And I think people wrestle through that their whole career, right? Is it going to be prioritizing your personal life, prioritizing your career? What kind of balance are you going to have there? And I opted to take a job at the cancer center, MD Anderson Cancer Center. Great for my career, really nice start off. I got involved in really big surgeries right away. I had the opportunity to be in a laboratory for part of the week. Great start, really a confidence builder on those big surgeries. That being said, it wasn't a location that I wanted to really be. Houston, Texas. It's not. I'm a Midwesterner. I don't like the South as far as weather. My politics are different. So I had to make that sacrifice to say this is an amazing job. I took that job. I had an amazing start, and I told myself I probably wouldn't stay there more than 5 years, but I didn't want to shortchange it because it was a great opportunity. So I stayed 5 years exactly. Really had a great opportunity to do a lot of operating and some lab work as well. So I think it's the perspective is different than when you're training. You're training, you go to college and then you look for a different medical school, and you might look for a different residency, a different fellowship, and you've got these finite times where you've moved around the country and had these fun experiences or learning experiences. There's always an end to it. And so when you take that first job, there's not necessarily an end to it, right? You might be, sort of the John Elway, right? And you're going to stick with the team the whole time and be sort of a franchise player at a location, or you may move around a little bit, and people make different decisions about that. So you don't have to leave, but you can leave if you decide you find something that's going to advance your personal life or your professional career, and you get to make that choice on your own whenever you want it. There's no one that tells you what time that you should do that. So, I made a move 5 years into that job, and you're right, I did have a different perspective than when I was a trainee looking for my first job, because no matter how many people you talk to, you've never done it before, probably. So you get there and you think, I didn't realize, but this is really important to me. They don't have this here, or this is really important to me, and I didn't negotiate for this. But now that I've built up a certain reputation, I have some credibility. I'm in a little bit better power position on negotiating. I'm gonna negotiate for that, because that's the thing that I'm interested in. So I think it puts you in a better position depending on how well you've done. So, I went back to where I went to medical school at Johns Hopkins and took a job there after 5 years at MD Anderson. I knew the environment. I was in a much better negotiating position. I had been really productive in my first 5 years in terms of academic productivity. I'd done a couple of traveling fellowships. I presented at a lot of meetings. I'd had some, moderate lab success. So I was able to leverage that and negotiate that into a lab opportunity and a clinical opportunity with a lot of resources at Johns Hopkins. So I stayed there for 10 years. And then I wasn't planning to leave, but sometimes places kind of implode a little bit. And I headed off to Penn, where their vision and my vision sort of matched in terms of what resources I would want to build a particular program. And so I took that opportunity, and I've been there for about 7.5 years now. So been academic all the way, but the perspectives change as you get further in your career, and you shift your goals a little bit as to what you want.
I really appreciate you sharing that in detail. So thinking about that also, what were some of the keys of your success that shaped your early career as you climbed throughout the ranks of the academic world?
Well, success, I guess, is defined differently by different people. I think for me, my mantra has always been to work hard. That's the number one thing, is working hard. There's no substitute for that. And there were so many weekends that I spent, 12 hours on a Saturday, 12 hours on a Sunday in my office, at my desk, writing articles, chapters, working on talks. That's time that you're not doing other things. And there's no 8 to 5 easy way to, probably be an academic leader in the field. You got to put in the extra time. And so working hard, I made choices. Everybody makes choices, intentional choices, and they all have consequences. I don't have any kids. I don't have a spouse. I've been very, very focused on my career. Not everybody's going to make those choices, and certainly not everybody has to make those choices to be successful in a career. The careers are very long, right? So if most people finish their training when they're around, early 30s, if you're super traditional about it. So you've got another potentially 30 plus years in this career. You don't have to do everything in the first 5 and the first 10. You've got a long time to make some zigzags, have different interests, move into different spaces. And so, I hit it pretty hard and moved up fairly quickly, but that is absolutely not everybody's path. Another tip, I guess, key is I tried to be nice, but not be walked on. Right. So that's a difficult balance. We can talk a little bit more about being a woman in surgery, not whining, making excuses, just owning, having that accountability for what I do and that intentionality for all of my choices. And then trying to be, excellent at everything that I do. Number one, being an excellent doctor. That's the key to the realm. You have to be a good doctor. And in surgery, you have to be a good surgeon. You have to be more than barely making it. You gotta really be a good surgeon. And I think when I talk to youngsters, I say spend as much time as you can getting those surgical skills honed. You want to be able to do things super well so you're respected in the field, because if you're not that good of a surgeon, people talk. And so I think, whatever courses you need to go to after training to get that additional skill set, having a colleague come into the room, your operating room, and help you out with a particular thing so you can build some skills, really critical to do that first, get those skills honed before you start moving into academic pursuits or other pursuits. I think you have to have that cred. But if you do things in an excellent fashion, people ask you to do more things.
Now, thinking about that and you being involved with different academic programs, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Well, I think you have to do your homework. There's no substitute for learning as much as you can about the opportunities that are out there. Those resources might be recruiters, they might be your professional society, specific colleagues, people that you admire that are maybe not too far ahead of you that can give you some tips. I think you really want to really take some time to think about what you want, but not be super restrictive, because that exact particular job might not be out there, just like mine was not exactly out there. Go for something that fits the majority of your interests. I think you don't want to underestimate the importance of your boss, or maybe your practice, your lead practice partner, or the work environment. I've unfortunately been in a couple situations where the environment wasn't that great, and it's hard to pick that up in an interview sometimes. But you really want to get as much information as you can about whether it's a welcoming environment, whether it's a conducive environment to what you're interested, whether your goals align with the folks that are hiring you. And some people want to have multiple partners so that they've got sort of a team of people that do what they do. other people want to be the big cheese, and they don't want anybody else that does what they do. So I think you have to really decide what you want. And, I'm just going to say, I think there's always going to be a job that pays more money. And I think if you're in it for the money, the likelihood of disappointment or of like just clawing your way to bigger and bigger dollar signs, I'm not sure that's a recipe for happiness. I think that, the work environment that you live in and work in, the people that you work around, shared goals, I think those are really much more important than folks might think before they're out in the job market. So it's not all about the money. One thing I forgot is I think, people are not born with the ability to negotiate. So I think you have to do some work on understanding how to negotiate. Maybe your training program has had some work related to negotiation, but if they haven't, there are lots of resources out there that you can take advantage of. I'd specifically say for women that it's critically important to not sell yourself short. And women notoriously negotiate poorly compared to men. So, you've got to be able to understand how to get to the job that you want and the package that you want.
Now, we all know that females are not as representative as much as males in the surgical specialty. So what advice do you have for the female demographic? Is getting them more involved, and also the obstacles that they go through?
Right. Well, I can speak to both men and women. Yes, you're right. Women are not as represented in the surgical specialties, although specialties like general surgery and otolaryngology, are climbing at a faster rate than orthopedic surgery. So orthopedic surgery right now is the least represented, has the worst gender representation. So we're at about 7% of practicing surgeons. We have about 15% of women residents. That's a pretty big disparity. And it does come with certain challenges just when you have that much of a disparity, because most people in the field are men. And frankly, they're mostly white men. So it means that we have to, all of us, be more intentional about our biases, understanding them, and just in how we interact, realizing that there are going to be people with different thoughts and different experiences. So I think taking that aspect, being more curious about the different people in the field is a critical piece that goes toward culture. I think women, this is a great field for women. I have had a great run. I love being in orthopedics. I have had, a great opportunity to train at a place where it was really supportive. So I would say in general, I've seen really some wonderful mentors and it's been good. I will say that I'm not blind to the implicit and sometimes explicit biases that are out there. And I think we have to be aware of that. And I think both men and women have to be diligent about calling that out. So when there's, been a disrespectful comment, whether it's in grand rounds or just in a small group, I think it has to be called out. And I think we can all do a really good job going forward of trying to change the culture so it's more welcoming to everyone. But as far as women going into the field, there's myths out there about you have to be strong to be in this field, orthopedics. That's not true. We've got all sorts of different instrumentation now that can modify to people's size. It's about position. It's about leverage. It's not about brute strength. So anybody is welcome. You just have to have an interest in the musculoskeletal system and the problems that affect it, and want to be part of that field. But I think the field itself, and I'm certainly, as I've moved up in the structure of our field, we just have a responsibility to make the path a little bit more welcoming to others that follow, which I know we can do.
I fully agree with you on that. And I think that allows us to jump into the fact that you were not only the previous president of the American Academy of Orthopedic Surgeons, but also the very first female president. Talk to us about what that was like and kind of the experiences you went through with that.
Yeah, well, it was an incredible honor. I think anybody who's been in that role, either myself or the 86 men that preceded me, have felt it was an honor to be able to serve the profession in that way. And I felt the same way. I felt a particular extra special honor because I was the first woman. And I think that, the saying is you can't be what you can't see. So I really wanted to do this to be able to, show younger folks in the field that these kind of positions are possible. And I want to spend the rest of my career paving the way so that I'm not the only one that has served in this role, right? It doesn't really help to just check a box and say that Kristy Weber, was the president back in 2019. I think we have to be able to just, see our leaders and choose our leaders in a different way so that we're looking at skill sets and what they bring to the table in different ways, and not just looking to have it be the same as it's always been. So I had a great year as president. It's a much tougher year this year for my successor, given the COVID crisis. We spent a lot of time looking at strategy, governance, and culture in the organization. We set a strategic plan that we really honed in on and are following to the betterment of the organization and to the value of our members. So it was good. A lot of change, great board of directors, great staff, really an opportunity for me to stretch my leadership skills and try to move the field a little bit.
Now, one thing that has come up with this year is due to the pandemic, everything is being done virtually right now. So what advice do you have for the graduating class regarding their networking and outreaching process?
Yeah, it is so tough. I feel for the men and women that are in that position now to be able to look for fellowships and to look for jobs in a virtual setting. On the other side, where I am, and as we look for people to join Penn Medicine, Penn Orthopaedics, having these interviews be virtual, it's odd for us as well. I think that, the benefit of a virtual presence to try and look for your next opportunity is that you do get to practice. You can have some props around if you need it. You can, put yourself in the best possible light, take a deep breath, and really put everything you can toward that interaction that's going to be really short, but really critical. And no different than in person. You want to think about what you're going to say, but I think you can really craft the location and how you come across. You have to get through this, but putting your best self forward. You can still reach out, like I did when I reached out to a number of different programs in advance to try to ask if they were looking for folks that had my skill set. You can still do that. Hopefully in 2021, we do open up so that maybe by the end of this year, the graduates are able to do something more in person and less virtual. But I guess just bring your best self to the table when you have these limited to technologies.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.